The Dr. Terri Show is presented by Avexius Health Solutions. Avexius Health Solutions is an emerging leader in the integrative medicine on a mission to positively impact people's lives through the transformation of healthcare. Avexius educates and trains practitioners on the new, innovative, integrative therapies that support a preventative care model that drives vitality as you age. You can learn more about Avexius Health Solutions and many of the healthcare topics we discuss on the Dr. Terri Show at Avexius.com. That's EVEXIAS.com, as well as find a provider near you. Now here's today's episode. Hey everybody, welcome back to the Dr. Terri Show. Today I'm going to be talking about a little bit about PCOS, or Polycystic Ovarian Syndrome is what it really stands for, PCOS. And we've learned a lot about PCOS over the last decade, and I think there's still a lot more to learn. I think there's a lot we don't know about PCOS, but so many people come to our offices that are coming into my clinic, or many clinics of clinicians we've trained across the country, with symptoms of hormone imbalance, and they don't realize it's not necessarily a hormone deficiency state as much as it is a hormone imbalance state or an endocrine disruption state, and PCOS is one of the biggest ones. It's really easy to miss because the typical triad of PCOS is overweight, infertility or irregular menstrual cycles, and what we call hirsutism, which is midline hair growth, right? In the beard, this face area, the neck, the chest. But 50% of women don't show up with those symptoms. They can be normal weight. They can not have any issues with hair growth. They maybe just have infertility issues. And so we've learned so much about this metabolic disorder, and that's what it really is a metabolic disorder. It's not so much an endocrine disorder first as a metabolic disorder. What does that mean? Well, let me peel back this onion layer. Over the last probably 15 years, we've come to understand that the root cause of PCOS is in insulin resistance. It precedes these abnormalities in hormone function and the cystic ovaries. But what is really interesting about PCOS that we've learned even more recently over the past 4 to 5 years is before insulin resistance happens, it's happening in, you know what I'm going to say, the gut. Right? Because the gut is everything. All disease begins in the gut, right? Hippocrates said it centuries ago, and it's true. So now what we know is a gut dysbiosis, or bad bacteria overgrowth in the gut, leads to the release of lipopolysaccharides. And lipopolysaccharides are highly inflammatory. They cause a lot of problems in the brain and all over the body, in the heart, cardiovascular system, everywhere. But one of the ways it wreaks just so much havoc on us as a population is it increases the risk and actually is a root cause of insulin resistance, also known as type 2 diabetes. So there's some really good studies that have come out over the last about 5 years or so that point to the fact that the gut is the first thing that happens that leads to the insulin resistance, and the insulin resistance leads to PCOS. Now, what happens in PCOS? Well, a couple of things. Besides a dysbiotic gut, meaning poor diet, obviously high sugar, high processed foods, inflammatory diet, inflammatory foods cause an inflamed gut, which causes this bacterial overgrowth, which causes lipopolysaccharide release in the body, which causes insulin resistance, which lays down more belly fat, which is highly inflammatory, but it starts to cause some endocrine disruption as well. And some symptoms of PCOS that women might complain of, besides feeling just off and tired all the time, but they might have symptoms of higher testosterone levels. Now, it's not always true that their testosterone levels are super high, except their free testosterone levels are typically higher than what we would normally see because their sex hormone binding globulin, or SHBG, is low. One of the key roles of sex hormone binding globulin is to bind up free testosterone and hang on to it until the body needs it. Well, in patients that have insulin resistance, and or PCOS, their sex hormone binding globulin is low, which causes a higher free testosterone. So patients have symptoms of high free testosterone like hair growth, acne, maybe hair loss, temple and crown hair loss. It also causes a lot of moodiness. There's estrogen metabolism disruption in the gut as well. And so the patient or the person will present to a clinician's office with all of these vague symptoms. And if you really don't understand how to see PCOS, you're not going to really know how to treat it, or your clinician isn't going to really know how to treat it. Now, many practitioners will put patients on some sort of androgen blocker or some sort of medication to block the testosterone receptors in the body. And that's a okay therapy. It definitely can help with the symptoms. One of the main ones we use is spironolactone. Spironolactone attaches to the androgen receptors in the body, and it works really well to decrease the acne and the hair growth because it's blocking that testosterone metabolite, DHT, from getting onto that receptor and causing more acne, more hair growth where you don't want it. And it also prevents the DHT from impacting and shocking the hair follicle, causing this patterned baldness that we see oftentimes in PCOS patients. So spironolactone is really great for symptom management, but what do I always talk about sitting in this studio is let's get to the root cause. So the root cause is the gut. But then the next root cause is the insulin resistance. So how do we treat it? How do we mitigate it? Well, number one, you can reverse PCOS. I have reversed PCOS in many, many patients. Now, I didn't do it myself. They had to do the work also and change their diet and change their lifestyle. But it is completely reversible. And I will tell you, I have worked with many clinicians and many patients in my own practice that we've been able to reverse their PCOS and induce fertility, and they've been able to have babies. And that is really a really sad part of PCOS. And we're seeing this just a rise of PCOS cases nationally over the past 5 to 10 years. Why is that? Because type 2 diabetes rates are rising. Our diet is really poor. The standard American diet, the acronym is SAD, and it really is doing some sad things. We're seeing PCOS younger and younger, in even, young girls that are 13, 14, they're starting their menstrual cycle so early, and they already have insulin resistance at such an early age, and it's causing PCOS. I have a 14-year-old that comes to mind right now, bless her heart. It's challenging, but it is preventable and it is reversible. You have to change your lifestyle. You have to change your diet. You have to move away from this high processed, high inflammatory, high sugar diets that increase insulin resistance. And what do those also do? Those also mess with the gut. So now kind of we're trying to figure out, well, which came first, the chicken or the egg? Do we have the insulin resistance or the gut? Well, it's happening kind of both at the same time. And more studies are showing that it's actually the gut problems that are happening that accelerate the drive into insulin resistance. So got to work with the diet. In the meantime, there are some great medications that are available for patients, and even some natural ways that you can address PCOS. Berberine is a natural supplement that you can use that does a very good job. If you get a good quality berberine, we carry a liposomal chewable berberine in our office, which is very absorbs very well. That's the thing. It's kind of hard to just go out and find berberine at any supplement shop or vitamin shop because you don't know the quality of that berberine. But a really good berberine can be as powerful as some of the medications on market like metformin. So berberine is a really good one. And then, of course, we have metformin. And then, of course, we have the GLP-1 receptor agonists like semaglutide, tirzepatide, and some of the other compounded versions of those medications that work beautifully. So let's get to the root cause. Let's address the gut. That means change the diet, get fiber in your diet, get some good probiotics, because what do the probiotics do? It raises the good bacteria in the gut, which kills the bad bacteria. And the bad bacteria are releasing those lipopolysaccharides, and we want to get rid of that bad bacteria. The best way to do that is get the good bacteria, the colonies of the good bacteria up higher. You do that with fiber, because fiber feeds the good bacteria in your gut and it grows and multiplies. And you also do that with taking a good probiotic supplement, right? So you can take probiotics, but be sure to feed those good, healthy bugs with enough fiber. So we definitely want to address the gut with diet and correcting that gut dysbiosis. The next thing we want to do is address the insulin resistance. Now, like I said, you can use metformin. You can get prescriptive help with that, with the GLP-1 receptor agonist. You can use berberine, which is a really great alternative too. But then the next thing you really want to pay attention to, and oftentimes PCOS patients, their thyroid isn't optimized. And optimized thyroid is a key. It's a mainstay to this PCOS conversation. The other thing that you really want to, you can address this with, and many young women will utilize birth control pills. There are certain birth control pills that are very safe if you're young. They are more what we call they block androgens really well. So certain birth control pills work in two ways. They block the androgen receptor, much like spironolactone, but they also raise sex hormone binding globulin. So all of that, that testosterone is bound up and can't cause the hair growth and the hair loss and some of those other things. So that is another medical way you can address it. So address the gut, address the insulin resistance with the things I've talked about. Optimize your thyroid. You can do that naturally. You want to make sure you're getting plenty of iodine. Thyroid hormone is made from iodine. You want to be sure you're getting plenty of selenium with that iodine, because a byproduct of thyroid production from iodine can be, you need selenium as an antioxidant so you don't have this release of thyroid antibodies. That's a whole nother conversation. I'm talking about Hashimoto's. My point is, to optimize your thyroid naturally, you need a really good thyroid supplement that has selenium, zinc, and iodine in it. Very, very important. So optimizing the thyroid, and if you're a candidate and your clinician understands how to optimize your thyroid, your free T3 hormone, not your TSH, then you might be a candidate for a desiccated thyroid or some sort of thyroid prescription. Another thing that we see with PCOS patients that's important to understand is they are, by and large, usually very deficient in progesterone. And this is why globally PCOS patients are higher risk for breast cancers and uterine cancers and even ovarian cancers. So progesterone is really important, especially if you're trying to get pregnant. What we see a lot is many clinicians don't understand this progesterone deficiency with PCOS, and their PCOS patient, they may be treating them with treating their insulin resistance, and they're getting, fertility coming back. It takes a while, but they don't understand the thyroid piece. So their patient gets pregnant, and if she doesn't have enough progesterone, she will miscarry. And I've seen this happen multiple times. So you have to optimize your progesterone for prevention of breast cancer, for prevention of all the other cancers that, progesterone balances estrogen in the system. So that's really important. And of course, if you get pregnant, you need progesterone in the first trimester, and your progesterone levels, serum, your blood progesterone levels need to be above 20 to maintain that pregnancy. 24 is ideal. And most PCOS patients have a very low progesterone and they miscarry. So progesterone really important, thyroid really important. Gut health is the foundational baseline of what you need to do for PCOS. But the biggest thing you can do for PCOS is simply to prevent it. If you are a parent that has a teenage daughter that is overweight, that is suffers with, is leading into insulin resistance and type 2 diabetes, the best thing you can do for that girl and your whole family is to make complete lifestyle changes early before they're driving in a car and can drive themselves to places where they can buy their own junk food. But monitoring that is so important. I know in this quick fix society that we have, we want to go for the quick things and the over-the-counter things, the packaged processed foods. And as parents, we're often very tricked with marketing. But just really, you can start this young. Start this in your kids young. Get them used to eating vegetables. Get them used to eating whole foods and raw foods. And don't, make any kind of, candy or sweet or something like that a treat that's an occasional treat, not an all the time treat. And listen, I'm speaking from experience. I was a Costco packaged processed food, mom that just had all these great snacks in the pantry for my kids. Whenever they wanted, they could just go in and get some sort of, nutritious snack that I was duped because of the marketing as well. But really what I wish I would have known then what I know now, because all of this packaged processed food has led to so much disease in our children. And the number one thing we're seeing on the rise in younger and younger children is PCOS. You can take a stand for your family and prevent this young. You can also reverse it. If you're trying to get pregnant and you think you have PCOS, you can do this yourself just simply by changing your lifestyle or finding a clinician that really understands how to treat PCOS. This was just a little blurb. There's so much more to talk about with PCOS. I'm sure I'll have some experts in this area on the Dr. Terri Show in the future to go a little bit deeper. But these are just some high-level things for you to think about if you or someone you know suffers from polycystic ovarian syndrome, and how you can start taking steps towards reversing and healing.